right, so let's now go straight into our discussion tonight. I'm going to talk about something that is almost never talked about. And that is thyroid. So we're going to look at this incredible organ, what it does, what is its role in this whole fertility discussion. You know what they say? They say this is the hidden hormone that quietly controls the outcome. Good evening, Lady G is here. Right. This is the hidden hormone that controls the outcome of reproduction. Good evening, Easy KVJG. You're welcome. Humble Queen is here. Maybe preconception blueprint and you're trying to conceive, I'll advise you to do so. Study it. Don't just read it. It's very small, 135 page. But if you study it, it will take you 3 months to finish. Right? So small, but yet it will take you 3 months to finish. Why? Because as you are studying, you are supposed to do. And the result is almost always guaranteed at the end of 6 months. Why? Because by that time you'd have prepared your body and your default setting would have been readjusted, right? So go and study it and do what we ask you to do. And if for some reason nothing changed, then we now know there is a problem. They will advise you on what to do to assist your body. Alright? So do it and come back. So let's go back to the gist. Let's look at thyroid gland. People don't talk about this gland because people don't even know where it is. At least you know where your heart is, right? You should know where your liver is, where your kidneys are. But this thyroid, what is thyroid anyway? It is a gland, and it's just here. It's just here, right? So we're going to be looking at how this unknown gland controls the outcome of your reproductive system. That is interesting, right? Because there's a pattern in fertility discourse. There's a pattern that always shows up again and again, right? Everything, when the discussion starts, they'll say things like everything looks almost fine, right? Like your cycle is present, ovulation is happening, right? Your test results are normal. And pregnancy is delayed. You've been trying for 1 year, 3 years, 5 years, 10 years, 15 years. But everything looks okay, right? Pregnancy seems not happen. Why? So, of course, but if you go to see your doctor, somewhere along the line, this particular organ will come into the gist, right? To enter the discussion, and you like, have you checked your thyroid? So how am I supposed to even know if there is thyroid? Not to talk of checking it, right? So this is where we try to make something that is so complex very simple, right? The reason why it may look complex is because thyroid is not loud. It's not a loud organ. Like for example, ovary, right? Ovary is loud. Everybody knows it. Thyroid is not loud, and it doesn't always cause obvious symptoms. The symptoms are not always obvious. But when something is off about this thyroid, even if it's the slightest change in thyroid, it can quietly affect or interfere with your ovulation. Right? It will also interfere, slightest change, not significant change, slightest change in what is going on in your thyroid will affect your ovulation, will affect implantation, that is if fertilization does take place, right? It will even affect pregnancy stability. This organ that is hardly talked about. So now let's move on to open it up properly and let the journey begin, right? Who's ready for this gist tonight? Please talk to me in the comment section. Just type ready if you're ready for the gist tonight. Let's take it step by step, blow by blow, so that even the person that has never gone to school will understand it. Like I tell you, when it comes to talking about these things, especially when I'm telling you, you don't even need to go to school to know it. Right? Why? Because it is your right to know. You should know. But you know why they put those big grammar? So that they can differentiate between those who went to school and those who did not go to school. But I think that is nonsense. That is nonsense. All right, let's deal with the first thing. The first part of the gist will be what this thyroid, what does it actually do? Right? What does it do? That is the beginning of the gist. Now, the thyroid first is a small gland. Small. Just like this. Smaller than a bow tie. It's smaller than a bow tie. And it's located here. Are you seeing my neck? If you cannot see my neck, don't worry. Just touch your own. Right? Touch your own instead. So the thyroid is a small gland that is located here. I think the only time people get to know about this thyroid is when they see somebody with goiter. You know goiter? When this place becomes swollen. Yeah. That's the only time they say, oh, there's something there. But that guy, tiny gland, is always there. Is always there. Do you know that it's the influence this small gland has is not a small influence. Small but mighty. Lovely Ifechukwu is here. You're welcome. Right? You know what I call small but mighty? That is what the thyroid gland is. I remember one time, and I'm sure they were deceiving us that time, even the government. And you know, when anything that government, let me enter those people small. Anything that the government spend weeks, months advertising, pushing, advising, lie there inside. Right? Lie there inside. I be sure that you don't go to benefit anybody. It's just for their own good. Right? They were saying, oh, you need to take iodized salt. Ah, I wonder, what do you people mean by iodized salt? The publicity was massive. Iodized salt, why? So that to prevent goiter, and all those kind of things. So you want to tell me that my grandmother, who was using that salt, I don't know, some of you are Gen Z, so you don't understand these things. You know that salt that is like stone? When they are cooking, they'll just crush it inside the soup. Sharp. And they just know how many times to scratch it and the salt is okay. Those people are wonderful. Right? So you want to tell me that salt was not good enough and they live long? And we that we are being pushed to take this one advertised by the government, we don't even seem to live long. God will help you. Go help you. I didn't believe those people. Anyway, so where was I? I was talking about how that this thyroid is a small gland and is located here at your neck, and it's a small but mighty gland. Small but mighty, right? It produces what we call T3 and T4 hormones. And these T3 and T4 hormones, they regulate metabolism. What is metabolism anyway? Like I said, now, the name needs to be big to put you back so that you say, now when I go school, not gonna go now, right? Metabolism is just another word for how the body break down energy and use it to make you the way you are, right? The way you use up energy, that's metabolism. So it's not a big thing. Maybe get out. Anyway, so this gland produce T3 and T4. And this T3 and T4 regulates metabolism, how your body uses energy. It also regulates energy. Now, how your body uses the food that it turns to energy, that is metabolism. Now, if the energy is produced, the same T3 and T4 will instruct your body how to use the energy. Is that okay? And also, it regulates temperature control. Right? Temperature control and, of course, hormonal balance. More importantly for fertility, it helps to coordinate how hormones behave. How hormones behave. Who is supposed to rise now? Who is supposed to fall now? To influence egg development, to influence ovulation, to influence the next phase of. So how they behave is controlled by this gland. Is that okay? So when the thyroid function for some reason shifts, even to the slightest, that small change will cause a ripple effect in other aspects of your fertility. Somebody will say, I don't understand my menstrual cycle in the past 3 months. Something has shifted. Of course, it was not always so. But for it to have happened within a particular space of time, something has shifted and you want to be interested. Right? So a slightest shift in the thyroid hormone will shift every other hormones, right? Let's get a little bit technical. Good evening, lovely. You're welcome. If you're just joining, you're welcome. Please tap on your screen, share the live, invite those that are trying to conceive because this information is for them. It's for them. Right? We'll give you as much information as possible that you need so that you make the best decision. Right? Thank you very much for the Go Popular. Right? So, let's go into this control system and see how it works. Humble Queen said, I thought it's spiritual. I've been thinking in our village. No. Majority of the things that they blame village people for is not them. It's not them at all. Even village people, they fear the accusation, right? So it's not village people. It's just lack of knowledge. Just lack of knowledge. And the problem, if you were here when I was talking about weight and stress, you will discover that most of the problem you have is you. most of the problem you have is you. And that's why if you're trying to conceive and you are not ready to be patient for 3 to 6 months, truth be told, I cannot help you. Of course, there are people who are willing to give you medications to bomb your system. The system don't want to move, they'll move it with medications. Well, whether that will help you or not will depend on many things. But I don't think in the long run it will help you. It won't. Before you give any medication, help the body to understand itself first. So that by the time you give the medication, even with the slightest dose, the result is instant. But it's not always so. Somebody who has been smoking the hell out of her lungs, right? Here in the clinic, say, "Oh, doctor, I've been trying to conceive, the thing is not coming. What can I do?" Say, "Don't worry. Go and take this medicine. Take it. After 3 days, come back." Right? I think something is wrong with you and that doctor. I think so. But again, it's business. Healthcare is a $1 trillion business. So, right? So if nobody tells you, I'm telling you, before you start going for medications, prepare your body so that even the medication will work effectively for you. Is that okay? All right, let's go back to the gist. We're going to talk about the control system, the thyroid and the brain, right? Because the thyroid doesn't work alone. It doesn't, right? The thyroid is controlled by the brain through a signal, right? And that signal is called TSH. Those of you that have gone to do hormonal profile or anything I mentioned now is in that your result. And I'm sure you're beginning to connect the dots. Okay, T3, T4, TSH. Okay, right? I'm sure you're beginning to understand. So what happens is that this thyroid is controlled by the brain through a signal, and that signal is called TSH. The long name, I usually don't like you to worry about the long name. The long name is thyroid stimulating hormone, right? So this is how the chain looks. The chain of command, this is how it looks like. The brain releases TSH, right? The TSH will influence the thyroid here to produce 2 hormones. That is T3 and T4. So when that T3 and T4 is released from here, it goes into your bloodstream. These hormones together regulate the body system, the entirety of the body system. If any part of this thing I just mentioned now shifts or went out or derails, the balance is lost. We need to wonder, I need to feel my body the way I did feel it before. I'm telling you what's going on. But the reason why we're having this discussion is we want to look at how it connects with fertility. So the question now is why thyroid matters for ovulation. Right? Why thyroid matters for ovulation. Remember everything we said about ovulation. Go to the YouTube channel, Dr. Godwin EMB. Search ovulation. Watch that video over and over again. You understand a lot of things. Because ovulation depends on precise hormonal timing. FSH must come when it's supposed to come. LH must come when it's supposed to come. And these two are controlled from the brain also. Right? So, I tell guys, instead of you to be pursuing skirts, right? Pursue the head. Because everything that is inside skirt is starting from the head, right? This update. I don't cast the update. Everything starts from here. Everything starts from here. If you can just get into the person's head, the person will follow you forever. Oh boy. All right. So I was saying that ovulation depends on precise hormonal timing, right? So when thyroid levels are optimal, right, the brain, remember the brain signaling system I mentioned yesterday? Remember I said something like the brain has a rhythm of releasing the control hormone, like poof, poof, poof. That's the rhythm, right? So when the thyroid levels are optimal, when everything is good, the brain signaling rhythm can change, right? It doesn't change, sorry. It's optimal, so it doesn't change. So it remains the same, and all your system works normally. But again, if for some reason that push is affected by some maybe stress, weight, or something that is affecting your entire system, and it becomes like push, that rhythm has changed. And when the rhythm change, FSH, LH pattern will become irregular. And that irregular LH and FSH will mean that the development of the follicle, what you consider as egg, will be affected. And that will result to delayed ovulation. It will result to weak ovulation. And sometimes ovulation will be suspended for some months. You need to wonder, what did they do me? What happened? I told you about sleep. I told you about stress. I told you about some things a few days ago. Right, so today is a build-up of that things I mentioned. Anything that affects that rhythm from the brain. So even when the cycle appears normal, the quality of ovulation may not be optimal because something is affecting the brain signal. Right? And that thing may just be your lifestyle. Now, there is something called hypothyroidism. Don't worry about the big name. It's just a question of where there is low thyroid function. The function of this thyroid here is low. That's what it means. That's what they call hypothyroidism. Don't worry about the name. Right? And this is one of the most common issues that people with infertility have. Right? So when the thyroid hormone is low, what happens? Metabolism slows down. Hormonal signaling becomes less efficient. The way hormones are messaged all about the body becomes less efficient. And now the effect on this, on fertility, would include irregular cycle. So why my cycle dey irregular since December? Are you now understanding what I'm saying? Ovulation is delayed. There may be increased prolactin levels, hyperprolactinemia, right? And increase of prolactin levels will suppress ovulation. So that is why high prolactin or hyperprolactinemia is a problem in infertility. So everything connects. And of course, pregnancy complications will start. Why? All this is because of low function of the thyroid. What about when the thyroid has a high function? Right? And this is very less common. It's not as if it happens often, but it's still important. That is hyperthyroidism, right? So when the thyroid is too high, the body becomes overstimulated, right? The hormonal balance becomes unstable. What was normal becomes unstable because of high function of the thyroid. When what really happens? How does it affect anything? What does it really do? This the effect. The effect is you begin to see that in irregular periods or light periods. Have you complained of light periods before? That's why I tell you, not be everything take drops. Now you're beginning to wonder, oh, so this is where the problem is coming from. This is life. Right? Irregular periods or light periods. Of course, it will cause disruption in ovulation, and there will be difficulty in conception, right? Now let's look at where many cases are missed, right? You may have been told that your thyroid is normal after the hormonal test. But in fertility, normal is not always optimal. I've always said this over and over again, that they said it's normal does not necessarily mean it is optimal. That is enough for the results you're looking for. Right? So for conception and pregnancy, thyroid levels often need to be within a very tight range, right? Even a mildest imbalance will affect implantation and reduce pregnancy stability, right? So let's talk about this implantation. What is the role of thyroid in implantation? Because it's not just what it does to ovulation. We now know what it does to ovulation. What about implantation? After ovulation, right? After ovulation, the uterine lining must be receptive, right? Hormone must support pregnancy. Of course, you already know, we talked about that, the role of progesterone and stuff like that. So the thyroid hormone influences the endometrial development. Remember, progesterone plays a huge role there, and thyroid hormones control the hormone, right? So just like your supervisor has a boss, the CEO. So while your supervisor is controlling you, there is somebody above your supervisor that is controlling the supervisor. So the thyroid hormones influence endometrial development. It influences blood flow and also hormonal support. So even if fertilization occurs, there's another part of the gist that must be considered: implantation. So if it is not optimal, implantation may be affected. Implantation may fail if thyroid environment is not supportive. All right. So that's where this tiny thing comes in, and that is its role. That is its role. If you are here and you are confused, talk to me in the comment section. Just write confused. Let's know you are confused. Right? Why? Because we need to now, I haven't talked about that implantation. What is the role of this thyroid in early pregnancy? Early pregnancy. Once pregnancy begins, the demand on the thyroid increases. Right? And the question is why? This is small thing here that you've never heard about it, apart from now that I'm talking about it. Right? You've never heard. And I'm telling you that once pregnancy begins, there's demand on the thyroid. And guess what? Majority of the people with thyroid issues are women, right? Out of 10 people with thyroid issues, how many are women? More women. Because the woman system is more complicated than the supercomputer, right? Than anything you can imagine. So why is it that when pregnancy begins, the demand on the thyroid gland increases? Why? Why is it so? Please tap on your screen and share the live if you're here. The reason is the development of baby depends on the maternal thyroid from the beginning. So when you become pregnant, your baby's survival is dependent on that your thyroid. So the thyroid must secrete adequate hormones to support the survival of that pregnancy. The body generally needs to adjust quickly to respond to that demand. And if the thyroid cannot meet this demand, there will be consequences, right? The consequence will amount to the pregnancy may not even progress properly. You hear things like miscarriage, missed abortion, or missed miscarriage and stuff like that, right? So that's what happens. And this is why thyroid screening is so important in early pregnancy care. So now that you've heard about thyroid, I know what is really going on inside of you. Are you going to take your thyroid very seriously now? Right? Take it. Right? But I need to help you because I know that besides this gist tonight, you may never really want to go back to that. Let's look at the common signs that may suggest that your thyroid is imbalanced. At least this one you remember. A lot of people are just being polite here. Oh, they don't want to say they are not understanding. Let it not be like, I'm just talking. So let me tell you the one that you remember. If you are just joining, you're welcome. I see you. Make sure you are tapping on the screen. Missy F, I see you. You're welcome. Tap on your screen, share the live. If you have not followed me, follow me now. Hi, MK. How are you? Good to see you. You're welcome. So I want to tell us the common signs that may suggest that your thyroid is imbalanced. Somebody should just tell me to leave it. Look, I just leave them. Lewis Catherine is here. That's what I'm talking about, Lewis. That's what I'm talking about. First, common signs that may suggest that your thyroid is imbalanced. Who's ready for this gist? Who is ready for this gist? Right? Somebody talk to me. Who's ready for this gist? Common signs that suggests that your thyroid is imbalanced. And remember, I said earlier that even the subtle change or slight shifts in thyroid function will cause magnificent problem. Right? Will cause it. MK said, what is thyroid? Don't worry, I'll drop the video in my YouTube channel. So you go back there and watch it from the beginning. Is that okay? So you will not miss anything. Just join from here and continue. The full video will be on the YouTube channel. And if you have not started following me or subscribed to me on YouTube, you're missing too much. There's so much information there that if the next generation will be diligent to go to YouTube, they will benefit from it. They may not even need to go to school, right? Right. So let's talk about the common signs that may suggest that your thyroid is imbalanced. Number 1, who is ready? Some people's ear just went like this, like a dish, like this. Let me hear that thing. And as I'm beginning to talk, you say, okay, so that is what is happening to me, right? So I said that all that to say, number 1, unexplained fatigue. Unexplained fatigue. Where is this fatigue coming from? Right? You've looked at your nutrition, you looked at your daily activity, you looked at everything. You really cannot tell. You're just right? Unexplained fatigue. That's number 1. Number 2, weight changes. Whether it is weight gain or weight loss is a sign that will suggest your thyroid is imbalanced. Weight changes. That is number 1 now. I can't remember. That's number 2. Number 3 is hair thinning. You that used to have lush hair. Anyway, but now we are even confused because women are doing things that even causing them more problem. Right? So we don't know whether it's thyroid that is a problem or is the chemical that you're using to destroy your system. That is. So I will say it anyway. I will say it. Hair thinning. You that used to have lush hair. Mr. Tabs is here. Right? You have lush hair. Bouncing. I'm not talking about those people who are trying to look like Oyibo people. Right? Your curly, sponge-like hair is good enough. I know we go carry something, stretch up. If you no stretch, you are not fine enough. Why are you like this? Right? Anyway, we'll come to that gist later. But for now, you that used to have lush hair, all of a sudden your hair started thinning out. Why? What's going on? It's a sign. It's one of the signs that is suggesting that your thyroid is imbalanced. Then this one is very important. Sensitivity to cold or heat. Sensitivity to cold and heat. You are in an environment, everybody is feeling one way, you are feeling the other way. Good evening, Mr. Tabs. You are welcome. Everybody feeling like this. You are feeling like this. It's a sign that your thyroid is imbalanced. And the ogak patak of them all is irregular cycle. That is the chief sign that your thyroid is imbalanced. But this is the key, right? You can have thyroid imbalance without any obvious symptom. So at least you already know what is possible. Does not mean that you must have symptom when there is thyroid imbalance, right? So have that at the back of your mind. So is it clear up until this point? If you understood something up until this point, talk to me in the comment section. Just type understand and I'll know you're there. If you're just joining, you're welcome. Tap on your screen, share the live. If you have not followed me, follow me now. Follow me now, because that will be the right thing to do. If you understand anything, type understand in the comment section so that we can continue. And by the way, if you are just joining, you've not heard about the preconception blueprint, go and download it. Go to the link in my bio, download the book. If you are trying to conceive, only if you're trying to conceive. If you're not trying to conceive, don't leave that book alone, because that book is for you to study and knack and study and knack until 6 months pass. We'll see whether you know get belly. Don't come and be asking me, which medicine will I take? Which medicine will I take? Go and read the book. Stop asking me questions. Because you always want to take. Christine LaBelle is here. So go and download. Go to the link in my bio. Look for the preconception blueprint. Download it. Wherever you are in the world, the same principles apply to all. If you're looking for solution, follow what we tell you. You'll be fine. Is that okay? All right, let's go to... Now we know the common signs. Let's talk about common mistakes. Common mistakes. Right? Common mistakes that people make. And the fact the chief of it all is ignoring the thyroid is a mistake in the first place. You cannot ignore the thyroid, because many fertility evaluations will only focus on your ovaries, hormones like FSH, LH, even do ultrasound findings, right? But they skip the thyroid, or they don't even interpret it deeply, right? That's where delay happens, because you are skipping something that looks silent but very important. It is the supervisor of all the hormones that is responsible for fertility, right? The reason why it will be a mistake not to look in this direction is because you can correct ovulation, but still you'll be struggling if thyroid balance is not corrected. You still be struggling. Why? I've done everything that should be done. So just an idea, your doctor will help you, but I just want to give you a mental picture, right? What a proper evaluation of your thyroid looks like. A complete thyroid assessment will include TSH, will include free T3, free T4, right? And sometimes we want to look at thyroid antibodies. This is to detect autoimmune involvement. That is situation where the body is fighting itself, right? Sometimes that happens, people don't know, right? All this is important because the full picture matters, not just one thing. If you have been trying to conceive 1 year plus, 5 years plus, 10 years plus, pay attention to what I'm telling you. Pay attention. The full picture, not just one thing. Don't just say, oh, my cycle is irregular. No, there are more to it than what meets the eyes. Is that okay? So when the thyroid is corrected, that is when the thyroid levels are optimized, what you begin to notice is your hormonal reading improves, right? Ovulation becomes more stable. The uterine environment becomes more supportive for pregnancy, and the outcome of pregnancy will improve. You are more likely to conceive quickly when the thyroid imbalance is corrected, right? Pregnancy, of course, pregnancy outcome will improve. And this is why thyroid correction can sometimes feel like a missing piece being restored. Do you understand what I'm saying? But this is a better way to understand this thing. Instead of seeing thyroid as a separate aspect of fertility, I want you to see it as a regulator behind the scene. I call it the supervisor of all the reproductive system, right? Why? It's a supervisor. Why did I say so? It does not produce egg. It is the ovary that does so. It does not carry pregnancy. It's the uterus that does so. But it influences how smoothly everything would work, right? So if you are trying to conceive or you're struggling with pregnancy outcomes, don't overlook the thyroid. Ask the question, has my thyroid been properly evaluated? Are my levels optimal or just normal? Is there any subtle balance affecting my cycle? Because sometimes the issue is not obvious. What is wrong with you may not be obvious, but it's correctable because now you know, right? If you're just joining, you're welcome. Thank you for the likes and for the follow, right? So, long story short, the thyroid is quiet, but it's very powerful. The thyroid is the gland that is here in front of your neck, right? Quiet but very powerful. When it's balanced, everything will flow smoothly. When it's not balanced, the disruption can be, even if it's small, can be very significant in its impact. And once you understand these things I'm saying, you stop overlooking it and you start using it to your advantage. And that's why we are teaching you what we are teaching you, right? That's why we're teaching you what we are teaching you. Right? Excuse me. Now, Lewis, are you still here? You asked a very important question. Are you still here? If she's no longer here, we'll leave it alone. Are you still here? Okay, she's not here. Okay, for the sake of people who have been tapping, because it will not be nice not to go home with very important information. Oh boy. Okay, you know what Louis asked? Louis asked a very important question. She said earlier that how can we correct thyroid imbalance? How can we do this? Right? That is why we needed to say the things we said earlier before I get to this point. Right? Remember that the thyroid is a regulatory gland. It regulates. So if something goes off with the regulator, it will affect multiple systems at once, right? So the correction is not about trying a random remedies. That's not how to correct it. It's about targeting the exact type of imbalance and fixing it precisely where the problem is. So the first step to this will be, you want to identify the type of thyroid problem, right? Identify the type of thyroid problem. Why? Because before talking about correction, you must answer the question, what exactly is wrong? And that's why I keep on telling people, stop rushing when it comes to fertility journey. You cannot rush, you cannot guess. You've got to find out what exactly is wrong. And with respect to thyroid, there are three main patterns in this thyroid gist. There are three main patterns. I mentioned them earlier. I want to mention them again to answer that question. I talked about the hypothyroidism, when the function is low, the thyroid function is low, or underactive thyroid, right? What you have here is you can have high TSH and low T3, T4, or low to normal T3, T4. The second pattern is hyperthyroidism, when the function of the thyroid is high, right? That is overactive thyroid. There you can have low TSH, high T3, T4. Then some people are the borderline. Borderline will mean is you're just at the margin of what normal is, right? So in this case, what they have is their TSH is slightly off and their T3, T4 is normal, right? Now there is also the issue of autoimmune thyroid disease. That is the presence of antibodies. I don't want to give you all these names, forget about them. Just understand the principle. Each of these things I just mentioned now requires different approach. So now you identify what they are, where the problem is. That's the first step. Second step, you want to correct the hormone levels. That's the core treatment. And this is the foundation. There's no shortcut here. Right? This is the foundation. For hyperthyroidism, the standard treatment is thyroid hormone replacement. Don't worry, go and meet your doctor. He will help you with the drug. Somebody's ear just open like this. Tell me the drug. I will not tell you. Go and meet your doctor. They will tell you. Right? So what that thyroid hormone replacement does is it will replace the missing thyroid hormone, right? It will bring TSH back to optimal range. Whether it was skyrocketing or it was going down, it will. Oh, good, unique, good. So keep at it. Make sure you do what you're asked to do. Is that okay? Right. So it restores the metabolic and hormonal balance which your body needs, so that other function will align. Don't play with it, though. Unique, stay on course. I believe in you. Stay on course. Right? And do not be in a hurry. Is that okay? And please give me feedback when you are through with it and the result comes. Is that okay? So that is if the functions are high. That is hypothyroidism. Let's talk about hyperthyroidism. Now, in the hyperthyroidism, the aim for the treatment is to reduce excess hormone production. Oh, good. Unique. Keep at it. Right? Are you following me? Follow me. I'll follow you back. I want to make sure. I follow up on your matter. Because this year, you'll get the results you're looking for. Is that okay? So, for hyperthyroidism, the treatment aims to reduce excess hormone production, right? And there are common medications for that, which I will not tell you. This one is just coming. Who asked that question? Onyito, go to my YouTube channel, Dr. Godwin EMB. The video will be there, so you start from the beginning and you understand where we are coming from, because I'm almost done, so you lost a lot of information. But go back to the video again and listen to it. You will learn. So there are common medications which I will not mention. I don't like mentioning medications on live stream, right? So your doctor will help you. So what these medications do is they slow down thyroid production. Remember, it's hyper. That is high function. So what it does is slows it down. Then stabilize the hormonal environment. So that's what the drug does, right? But understand this truth, that if hormonal levels are not corrected medically, lifestyle changes alone will not fix the thyroid balance. The thyroid imbalance may not necessarily be fixed, but you need the lifestyle changes, right? You need it. When you do that, then medications will help you faster. But if you don't want to change your lifestyle, you want to use medication to force your body, I don't know the long-term impact of that. But the first thing you need to do, change your lifestyle, right? Change your lifestyle, right? And that is why if you're trying to conceive, you need to get this book, The Preconception Blueprints. The link is in my bio. Go and download it. Study it. The pages are few, but it will take you 3 months to finish it if you are doing exactly what we are asking you to do. Right? Okay. Because it's a practical guide, not just an education. For everything you are asked to, you are taught, you must do something real time to get the results. Right? Yeah. Thank you for confirming it, Unique. Because if you are there, you actually know what I'm talking about. And I don't wish that on anybody. That's why I'm begging you guys now. Please make sure you are doing what we ask you to do. And if you don't think you can see me on the live stream again, go and download this book now from the link in my bio. Go to my bio. You see a link there. Tap on it. You will see the book. There are several things there, but look for Preconception Blueprint. That is the 3rd item there. Tap on it and download. Study it. Give it to your friends, all the women in your life, because we want everybody go born Peking this year, right? All right. So that is step 2. Step 3 is to address the root driver of the problem. This is where you go deeper, because medication stabilizes, right? Medication stabilizes. The root factors, right, is what you are looking for. the root factors that influence the long-term control, right? And in step 3, you want to be able to use these what I call factors to control in the long term. Factor number 1, iodine balance. Iodine. Yes, they don't at all. They don't. Hardly will you hear anybody talk about thyroid. Hardly. Right? So iodine balance, not excess and not deficient. Right? So if you don't know what to do, follow government prescription. Use iodized salt. Full stop. Right? Yeah, I don't trust government, so but if you don't even know what to do at all, you can use that one. Right? I said all that to say that the thyroid needs iodine. Right? It needs iodine. But in the need for iodine, it must be balanced. Balance matters. You cannot have too much iodine, and you cannot have too little iodine. It got to be balanced. Right? So if you have too little iodine, it reduces hormonal production. If you have too much iodine, it can worsen the dysfunction you're already suffering. Confusion, right? So where are the sources of this iodine? You can get it from iodized salt, like your government has been advertising all over the place. And you can also get it from seafood, which I prefer. You can get it from seafood. Enjoy. It's not your money. Why are you working? Enjoy your life. And please avoid this random iodine supplementation that you do all over the place without testing. I want people to take supplements, but don't just go and take supplement because they say supplement is good for fertility. You don't know what you are doing to yourself. Anyway, get out. Do whatever I like. So the first one is iodine. The second one is selenium. Selenium support. I wish Lewis was here. She just asked the question and she ran away. Selenium support. Why? Because selenium it helps to convert T4 to active T3. Forget about those details. Leave it for students in the school. Right? So what it eventually does is to reduce thyroid inflammation. And where would you get natural source of selenium? Eggs, fish. There's this thing they call Brazilian nut. Me, I don't get it. If you get, way bill it to me, right? You have it. Way bill it to me. Ade Love is here. You're welcome. Missy F, calm down. Okay, Brazilian nut is on Amazon. Okay. Oh, see update too. And you una no pay. I will not talk again. See update I'm giving you guys. Right? So the third one is your iron status. Iron status. See, low iron can impair thyroid hormone production. Right? Unique. You don't know my weak points, but my mouth didn't agree stop. So I said that low iron can impair thyroid hormone production. Iron is not. I know the last time you heard about iron, you heard that with respect to blood, but now thyroid has entered the gist. Is that okay? So low iron can impair thyroid hormone production. It can reduce the treatment effectiveness. Low iron. So in that treatment, iron also should be part of the gist. And unfortunately, this is often overlooked in women. Anyway, thank God, that's why knowledge is coming to you today. So that by the time you sit before your health care provider, you're asking important questions, not foolish questions, important questions to help yourself. You understand what I'm saying? Thank you for the rosy. Right? Remember, we're still talking about solutions, right? If it is present, you need to control autoimmune situations, right? And this is a condition like I don't want to mention the name so that it doesn't. If I mention the name now, somebody say, "Hey, the hour don't finish," right? Because patients don't like to hear big names. The moment you say big names, the hour don't finish. They'll just faint first, without even knowing what the problem is. Right? By the time they wake up from their coma, they'll say, "Doctor, how much does this thing cost?" So that's why I don't like mentioning big names, because if it's simple, it will be easy for you to assimilate it and work with it. But when it's big name, your brain will just shut down. Say, "No, it's not for me." The fasting and prayer will start. You go to the mountain. I cast, I bind, I cast, I bind. It is not a big thing. It's just the name that is just big. All right. So I said you need to control autoimmune situation, right? And if it is present, yeah, in conditions like they call it Hashimoto's, right? In this Hashimoto, the issue is not just the hormone levels, right? The immune system, that is your defense mechanism in your body, attacks your thyroid. Is that not a serious problem? Your own defense system locate your thyroid and attack it. Right? So how do you support this kind of situation? First, you want to reduce the chronic inflammation that is caused from that. Manage stress and monitor antibodies. The antibodies that are fighting your body. You want to. So your doctor knows what to do, but at least you have an idea now. Is that okay? Then the Oga Pata of them all, right, is lifestyle. You want to optimize your lifestyle. And when it comes to lifestyle, stability matters. Stability matters. Look at this thing. If you ever needed medication, right? Medication will correct the levels, the thyroid hormone levels. But guess what will keep it stable is your lifestyle. After mechanic work on your vehicle, is it the mechanic that will now continue to maintain it for you? No. It is you that will have to change oil, change water, buy fuel and stuff like that. So medications will correct the problem. Your lifestyle will keep it stable. Is that okay? So what are the lifestyle that needs to change? Please share this life. I'm just thinking, there is somebody somewhere crying to, oh God, I'm trying to conceive. Help me. The help is on TikTok. If they will just grab their phone and enter TikTok, they will find us. Only if you will tap on your screen. Alright? Please tap on your screen, share the life. Tap on your screen and share the life. Right? If you're just joining, you're welcome. If you're not following me, follow me now. So the first lifestyle that must be attended to is sleep. Sleep again? Wonderful. By the time I'm done with you this year, you go to sleep by force. Sleep. Can't you sleep? Close your eye. Close your eye like this. Close your eye. Lie down and sleep. Now the cervical incompetence. The next one they need to put sacrilege. So don't worry, it can be managed. It's not rocket science. Right? So sleep. Why can't you sleep? I beg, please help me ask your neighbor in the comment section. Why can't you sleep? Right. This sleep that is free. This sleep that is free. So when you come back after your 9 shifts, do you sleep 7 hours? Because people are using that as an excuse. It's better at night, but if you need to work, make money. Now, if you make money, should be me I will get small inside, right? So, Lewis, you've missed the answer to your question. So you go to the YouTube channel and get it from there. Mrs. said that men wahala, now make them need to sleep. Adela said his phone. Sleep. Close your eye. Close your eye. Hold on. If the eye refuses to close, hold it like this. Lie down and sleep. Sleep. The reason is when you don't know that poor sleep disrupts the TSH rhythm. It does. It disrupts hormonal coordination. Look at what we said the other day about sleep. Sleep 7 to 8 hours at least. Lie down, sleep. Wake up refreshed, full of life and energy. Now we'll see whether in 3 to 6 months' time, we'll get results. What you want to do, you want to target consistency, and more like a restorative sleep. Because when you sleep, it has to be. It's not just the quality. English, they had me. It's not just the quantity of sleep. It's also the quality of sleep. Right? It's not the quality of sleep. Close your eye and sleep. Quality sleep. Consistent sleep. Restorative sleep. And Mark's baby is here. You're welcome. Right? Akua Otiwa, you're laughing me. English, they had me. Mona, leave me. Right? I think it would have been more easy if I was having exactly. Coffee is here too. Coffee is here. Good evening, Max baby. In fact, I think I like Kafi's recommendation. Kafi said, knack waiting no good before you sleep and you will rest well. Exactly. That is true. Knack waiting no good. Happy New Year, Max baby. So sleep. Focus on consistency and restorative sleep. Quality and quantity. You wake up alive and well, full of energy. You'll be amazed. Every aspect of your life will change. And yet, there is no place here we have mentioned to go and take any drug. But will you sleep? Then you go ever agree to sleep. Lie. I dey love you, the hustle. Now hustle they cause am. So that is the first thing, sleep. Second thing, stress regulation. We talked about stress yesterday, right? So if you missed the video, go to YouTube, Dr. Godwin EMB. Subscribe to me, please, and grab all you need to grab there. Stress regulation. Now you see, understand this. Do you know that chronic stress can affect the hypothalamus? Hypothalamus is somewhere in your brain. It affects it and you disrupt the thyroid signal, causing confusion. And that disruption and confusion is linked directly to stress, and stress leads to increased cortisol levels. Increased cortisol level leads to hormonal imbalance. The confusion is just tie wrapper all over the place. Stress. Manage your stress, whether it's physical stress, whether it's emotional stress, whether it's psychological stress, or even if it's spousal stress, right? Whichever one, right? So if you want the consultation privately, go to that same link. You will see fertility consultation. Tap on it. It will take you to my DM, to my green app. Actually, it will. So that is number 2. So the first one is sleep. The second one is what again? What's the second one? Who is listening to me? Thank you very much, I'm Max baby. Thank you very much. What's the second one? The second one is stress. Then the third one is nutrition pattern. Chop. Food, nutrition. Instead of eating like me, right? So how do I eat? So anyway, that just by the way. So instead of eating extreme diets, right, I want you to focus on balanced intake. Yeah, Mola. Don't play with this thing I'm telling you. Don't play with it. If you play with it, it's you that will lose. Don't play with it. And all these things, you don't even need money. That it is in your hands. It's in your hands. So that's why in this book, if you have not gotten this book yet, go and download it in my bio, the link in my bio, the preconception blueprint. All those guides and checklists and practical steps I put there, follow them in the next 3 to 6 months. Come back and tell me it did not work. Then I'll follow you to your village. We want to appease those old people that refuse to die, to leave you alone, right? Anyway, so that's just by the way. So download the book. It's going to help you. So where was I? Nutrition pattern. So instead of you going the extreme in diets, focus on balanced intake of food. Avoid severe calorie restriction. You know, some people are watching their weight for whatever reason, only God knows. Some people are eating recklessly for whatever reason, only God knows. Some people are just bent on eating junks. If you ask them, what have you eaten today? Pizza, cake, donut, ice cream. Go remain for Oraimo cord to enter your back. Is all these things, are they food? They're not food. They're not food. I don't know what you want to tell these people. Well, I just said all that to say that your thyroid respond poorly to starvation signals. So you want to eat normally at the right time, right? And I'm not aware that there's any place they say you must eat 3 times a day. There's no place. Eat when your body demands for food, right? You're eating all these processed junks and you are not even active. And you're wondering why your size is going like this. Big. You will grow big because you are not in any activity that is cutting it down. Junk is not even, it's fake sugar. Junks, fake sugar. You're just spiking your insulin, destroying your system. But when you eat real food, good food, and you burn it accordingly, your life will just be like this, right? Do it. Also, the next one is weight stability. Weight stability, right? Weight stability. And I said yesterday, was it yesterday or the day before, that you cannot be too big and you cannot be too thin, even though I am in the Orobo gang. So Lekba, I want to stay this side first, right? No vex, right? So, weight stability. You cannot be too big, you cannot be too thin. Go and check your BMI. Check your BMI. You've got to be within the range. So when you know your weight and your height, go to Google, search for BMI calculator, put it there. Know your BMI. Where do you belong? KK Love. All right, KK Love, it's fine. Right? Because, see, let me tell you something. If your weight is very low, it will suppress thyroid function plus other reproductive function. I have said that before. If your weight is too high, it will resist functions and patterns in your reproductive system. So you cannot be too big and cannot be. So go and find out your BMI. Is there somebody here you don't know what BMI is? Talk to me in the comment section. Let me direct you now before I go. So the next thing you can do is to monitor and adjust. Right? Monitor and adjust. Go and check every 6 to 8 weeks. You check your TSH, T3, T4. Right? The doctor will help you with all that. And all this is important. This checking is important when you're trying to conceive and during pregnancy, right? Because requirements can change in both cases. So please make sure you're working with your doctor. Know thyself, right? Thank you very much, Big Baby. Thank you. Do that tomorrow, right? So, if you're trying to conceive, precision matters. Before conception, you want to optimize your TSH to anywhere from 1 to 2.5, right? During pregnancy, the thyroid demand will increase, of course, you know that, and medication dose may may need to be adjusted actually, right? But you need to know that when there is an uncontrolled thyroid imbalance, it can affect ovulation, it can affect implantation and pregnancy stability, right? So this is not optional, it is actually the foundation of the whole gist. Is that okay? So go through it with knowledge, meet your doctor, let them help you out. If you are confused, you can always DM, I'll guide you, right? And I know that people make common mistakes of, after talking like this and all that, they rely on herbal mixtures without diagnosis. They say, oh, I don't understand my body, I won't conceive, or give me herbal, let me go and take. I know you do that, but please, first know what is wrong with you before you go for herbal mixtures. Is that okay? Some go and take iodine blindly because, oh, I said iodine is one of the solutions. You find out what your problem is first, right? And several other things. So if you are in doubt, go and ask your doctor, right? So what needs to be done? Test first, identify what the problem is, treat the problem, have a lifestyle that supports the treatment, then monitor from time to time. The problem is over. And we'll come for naming ceremony when the time comes, right? If you have questions, come up, ask question before I go.